So let's talk about ovarian reserve again. We saw that graph of the probability of conception in the beginning of a webinar. And so why does that happen? Conception has to revolve around the quality and the quantity of the eggs in the ovary. And so the way humans are designed, every month there's a group of eggs that the hormones that we talked about before recruit. One of those eggs becomes the dominant egg, and that's the egg that's ovulated. But that group, whether it's 12 eggs or 30 eggs, that dominant egg comes from, undergoes a process called atresia. So those eggs don't ovulate. And so as that group becomes smaller and smaller and smaller, that process leads to a decrease in the eggs left in the ovary. Again, there's nothing wrong in women who have a decreased ovarian reserve. That's just kind of their physiology. The issue is this graph can be a little bit faster in some women and a little bit slower in other women. So everyone is, again, very, very different. And that discussion has to be done on an individual basis. So for example, in our practice, we don't have age limits. And even in the IVF practice that I have here where I am, we don't have age limits, again, because everyone's different and this curve is different for everyone. Typically, we test ovarian reserve with AMH, or anti-Mullerian hormone, and that correlates reasonably well with the probability of conception and the probability of response to ovarian medication that would lead to conception, whether it's IVF or whether it's oral medication. We start seeing subtle drops in pregnancy rates like we discussed before after the age of 37, whether it's natural or whether it's pregnancy that's assisted. And after a certain age, again, everybody's different. It depends on how this process is in your ovaries. But this sometimes can lead to irregular cycles, and then ultimately, when the number of eggs is exhausted, it leads to menopause. Again, so what has changed in the last 5 years? So all this testing can now, again, be done in the comforts of your home. So what we can do is we can send you your AMH test. There's no reason for you to go to the lab and have this painful blood draw. It's a simple finger stick, and then we can get your AMH levels to you within a week or so. Now, again, AMH levels correlate to your probability of conception, whether it's spontaneous or whether it's assisted. And once AMH goes under a certain level, specifically 1, in combination with your age, that may be an indication for you to be much more aggressive in terms of trying to get pregnant.